Good evening, everyone, and welcome again to our weekly COVID-19 Town Hall. And again, this evening we don't have a CE program per se, but we do have information to share. And I'm glad to present Louis Solano, who is our co-chair of our new practitioner section, and he is a pharmacy manager with Walgreens. Which Walgreens are you at?
Vernon Hills, Illinois.
Vernon Hills. And he was fortunate enough to be part of the Walgreens team that was part of the first team on the ground helping out with the U.S. Public Health Service in testing COVID patients. And we asked him tonight to kind of share some of his experiences and being on that team and now transitioning back to his store and how that has transitioned into his normal practice. So I'm going to put myself on mute and turn it over to you, Liz.
Okay. Hi, everyone. It's good to see everyone again in a virtual setting. As far as my experience, I would say it's one that I'll always remember. I got so I was working right before the pandemic kind of hit, and we got, the stay-at-home order got all, in there, and it was moving very fast. So I was working at the pharmacy one day before all this hit, and it got really busy. We got up to like 180 prescriptions on the counter that needed to be filled. It was getting really hectic. That weekend, I always remember, it was a weekend of St. Patrick's Day. I got a phone call that Sunday morning from one of my higher ups saying that if they were, they just announced that Walgreens and all these other companies are going to partner up with the federal government to provide COVID testing for patients. And we had no clue what that was going to look like and how it was going to kind of go down. So, not knowing much, I was like, sure, let's do it. I've always been a proponent of trying new things or experiencing something like this, right? This is kind of like what we are built to do, what we learned to do. So, so I said I was all in. By that Monday, I was already, getting a webinar. And then that Tuesday, I was in the corporate offices in Deerfield at Walgreens. And we had like a whole day of training, and we learned about donning and doffing and how that would look like. And this is all early on. This is early processes. They were like the team that was working on this. It was always changing, ever changing every day, and how we were going to do it. And so every day we just kind of had to be adaptive to it and figure out what was going to happen next. Within that week, St. Patrick's Day week, we were then at our closed site in Bolingbrook where we started everything. And then by that weekend, HHS had arrived. We had 4 people from HHS that we worked with. And we basically tested our first responders that following Sunday. So within a week, we were trained, we were set up in Bolingbrook, and we started taking patients that Sunday. And then Monday, Tuesday, we started getting more and more people. And we did that for about 3 weeks where we were performing nasopharyngeal swabs. So basically that we were trained how to do that. We had a partnership with a health system called Premise Health, and they had nurse practitioners and nurses that came and signed off on us pharmacists to be able to do the actual nasopharyngeal swab. So we were trained how to do it, and then we also performed and then signed off that we were certified to do it. So then for about 3 weeks or so, we had a good 150 patients every day that we were just swabbing. So we'd rotate, we'd gather. We were in full PPE from the Tyvek suit to a face shield to face masks to gloves. We were all donned up. And so basically we would take care of each car that came by. We were assessed as a first responder, because in the beginning, the criteria to get tested was very strict. So you had to be a first responder, healthcare worker, things like that to get tested. As you know now, the requirements are very loose. So you can basically be symptomatic or asymptomatic or whatever and still get tested. But early on, it was very strict. We had HHS would basically profile people and make sure if they were eligible for the test or not. And then us as pharmacists and other people would kind of guide them through this process we had. We had people called runners, where we register them and this paper we had in this form. We'd check their ID, all with their window closed. So again, very little opening windows and closing windows. It was very, just to protect everyone around in the site. And then we'd guide them around, and then we got to the 10 where they would perform the nasopharyngeal swab. We were very empathetic with them. We were like, hi, my name is Dr. Solano. I'm here to perform the swab today. They were very happy that we were there. And it was a nice, kind of thing to see, opposite of being in the pharmacy, right? In the pharmacy, you deal with a lot of people who are not necessarily in the best mood. So seeing these people being really appreciative of us being there was very cool. It was very different than what you're used to. So yeah, we do that every day. Basically, we were open 7 days a week. You know, if it was raining, we wouldn't do it just because that could compromise the patient and person who's doing the test safety, and also compromise the sample. So all these samples were then we would perform the nasopharyngeal swab. A lot of them would cry or whatever, you know, but they did it because they want to get tested. And then this was sent out to a lab where they would get the results within like 5 days, sometimes longer, depending on the backup of the lab. So I did that for about 3 weeks, and then after about beginning of May, they had announced that we were going to be getting the Abbott ID Now machines, which really is a game changer for testing, because then I transitioned to another site in Chicago where we had a whole different population from what was in Bolingbrook. We dealt with, you know, minority patients, people who only spoke Spanish or other languages. So me knowing Spanish, I was able to communicate with those people because I was the only one who could speak Spanish at that site. So I was able to communicate with these patients, making sure that they understand what's going on. And we transitioned from doing nasopharyngeal swabs to basically doing the self-swab technique. So basically what we would do, we had less PPE on, but we had a mask, we still had gloves, we still had the appropriate things to help keep us safe. But then the patient would do the swab themselves. So they weren't going as deep. It was all in the front of the nose, and nice nostril swab. We would basically assess if they were eligible. By that point, the criteria was a little bit looser. So again, this time we could do like 65 plus with symptoms, and then like again, first responders, healthcare workers. And then by the time I was leaving, we were basically doing everyone. So it was quickly how it progressed from what was being tested originally to now. So yeah, so a big thing with this is that kind of learning with the type of people you're working with. The people sometimes didn't want to listen to what you're saying. Keep your windows up, yada yada yada. Repeat that over and over again. So the type of people we worked with, you know, was different day to day, and but everyone wanted to get tested. That was the thing. Everyone was eager to get tested and wanted to be tested, and we were happy. They were happy that we were there. You know, and so the process, it was very, very ever changing, right? So we learned every day what would work, what wouldn't work. The working with the Abbott ID Now machines were really, like I said, a game changer. People can know the results within 24 hours or less. If it was a positive result, the machine would know within minutes. Whereas if it was a negative, it would take maybe 10 to 15 minutes, depending on the machine or on the sample. So dealing with that was really cool. We were processing maybe 100, like I said, 150 tests a day just on site. And we were able to call patients, we also worked with a health system called PWN Health, where they then make the appointments online, kind of to make things more mainstream. And we were, you know, organized that we would print the appointments at the beginning of the day and making sure that they were assessed for that specific day. You know, and it worked really well. We had a well-oiled machine, we got organized, and the experience itself has been quite, you know, exhilarating, because I was able to perform a little bit of different practice than the usual dispensing, counseling, immunization thing, type of things we've been doing. And being one of the first pharmacists to do something like that was really, really an interesting thing. And then, as you know, HHS passed that legislation where we were able to now order lab tests for patients. So if a patient didn't have an appointment that came onto site, us as pharmacists, using our NPI number, were able to actually just order the lab tests right then and there for them. So that was really a big game changer for us as well. And you know, and of course, all these tests were funded by the government, so we don't have to worry about the billing part of it. But it was really cool to be able to use our authority to be able to perform a test like that, or to also order one. And then also on the side, we also can order like the COVID-19 antibody test. So I've actually ordered for some of my patients, or like some of my family, my friends, to get the antibody test as well. So that's been really cool that I can have that authority to do that. And I think that's really important, because it gives patients more access to be able to get a test, instead of having to talk to a physician or having to talk to another healthcare provider, and knowing they can just see us and talk to us. So I think all of that in combined is a game changer of how the profession of pharmacy can go, and can really show what we can do as a profession. So experience itself is something I'll never forget, and it's still going on. So actually, I was out today helping set up a new site in Des Plaines, Illinois. So we're still going, and you know, and me being back in the store, getting that back to that adjustment of life. You know, we're wearing masks all the time. We're doing daily temperature checks. You know, a lot of people are utilizing our drive-through, so that's kind of nice to kind of keep people in the drive-through versus having to come inside the store. Definitely the traffic inside is lessened a lot, which is good. I'm thankful for me and my staff. But yeah, so the precautions are there, and and we're hoping as things progress forward, we can figure out a solution to how make sure we stay safe moving forward. But overall, the experience has been very exhilarating, and I recommend anyone who can do it to do it and get involved some way, shape, or form.
Excellent. Thank you very much for sharing your experience and
Of course.
stepping forward, because this is, I'm sure it was not a easy ask at first, and
Right.
you probably had some reservations before you completely said yes.
For
but we're
sure.
glad you did say yes.
Yeah.
Right.
There were a lot of questions because, again, it was one of those things they didn't know all the answers, right? So we had to kind of go in with an open mind. But I felt very reassured with how Walgreens is leading it and how it was being executed. So I had no doubts there. So it was really good.
Excellent. Again, if you guys have questions, please raise your hand or type in the chat box. Starlin did have a question for you. What process did you use to order the test?
So we have these printed up sheets that we would just use on site. And basically all we had to do is put our name and our MPI number into the sheets. And that was basically how we would then record and order the tests. For outside of the testing process, I just use my general script pad that I have at the store to write out any sort of test that I have for patients that need it or my loved ones. So that's been kind of nice. So I think I know a lot of, when you're taking your orders from physicians on those script pads at the pharmacy, you can use those to order your tests if needed for your loved ones or whatever, if you want to get tests done.
Has anybody questioned your order?
I've had many go through LabCorp, and I think that's been pretty good. And I mean, there's been a little bit, I think, of how to register me in the system, but they've had success every single time to do it. So it's been okay. Because that was my worry too.
Yeah, HHS, did someone just record all that? I mean, how did they document all this in their system? Did they have something on site, or was it all paper and then somebody else is going to put it in?
And then we all submitted, in the background. Yep.
And there's another question about whether this was a collaborative agreement required, or did you guys, because I know at first before the general order came out, so were you guys doing this under a collaborative agreement at the beginning?
Yes, we were. Right in the beginning, when we first started, we had a physician on the order. So that's how we started it back in the beginning of March, mid-March. But yeah, as soon as the HHS passed that, I think based on what we were doing with them, working with them at the site and other sites that were being built with HHS, they said, yes, we should have pharmacists do this. So I think us doing that and showing them what we could do kind of made it a no-brainer for them. They said, yes, let's make pharmacists be able to do this too. So I think that was cool.
Great. And then one of the questions was, and I think you may have stated this already, but when you're submitting everything, are you doing it as your MPI number or as the store's MPI number?
No, my personal MPI number. So all the pharmacists that worked there had to either have one already or make sure they applied to have an MPI number with them. And I had done it last fall when I graduated and became licensed. So I just did it just because you never know what could happen like this. So
that's right. Some of us have been waiting a long time to use our numbers. So,
for real.
Glad to see that you were able to.
Yeah, exactly.
Let's see here. Abby says, congrats. Dave said, did you have access to the results of the test or the percentage positive or differences from both sites?
So what's interesting is for the results for the nasopharyngeal, we didn't really have access to because those were sent out to an outdoor lab. But for the sites we did on site, yes, we had access to the daily numbers every day. So when I was at the Chicago site, we averaged about, dependent in the beginning, about 28 to 25% positive out of the patients that we were testing. And it's now hovering downward, as you can see, as a state, we are going down. So I know we're hovering around 15% and going down consistently, which is really awesome. We're still doing 150 patients a day, though. It's still pretty consistent.
Oh, wow.
Yeah.
Lisa asked, did you see a rise in indeterminate results when you switched over to the self-testing?
Like invalid results?
I guess so.
Yeah. So so the Abbott ID Now machines, you know, so positive, negative, but sometimes, yes, we did have the invalid that came up. And so with those patients that have invalid, it didn't happen often, but we kept wondering why that kept happening. And so a lot of research was going into it. We kept looking at like the package insert, and we called Abbott several times to see if they can give us a concrete answer. And I think we've figured out, I think recently, that if there's too much mucus in the sample that's being swabbed into the machine, it can come up as an invalid, or if there's not enough sample. So either way, it's kind of a caveat to make sure that there's enough sample on the swab. And we've seen some doozy swabs, really, right? It's like bloody swabs. We've seen booger-filled swabs. It just depends on the patient. But it's good to have, you know, having them making sure that they know how to do it and understand it. That's been something we had always had the stress about when we're talking to patients, and like, you know, how to do it.
Let's see here. Tanya's asking, do you know if there are plans to roll this out to more Walgreens sites in the Chicago area?
Yeah, so from what I understand is that, like I said, they're opening up a new one this week in Des Plaines. I think they're trying to plan to open up another one in Deerfield area. So they're starting to pop up quicker now, just because it's, you know, basically mirroring and then moving, you know, moving the, you know, that same process over. And what's really cool is for all of us that are trained, they can divvy us up and like train other people so that the process can continue growing, you know? So it's been really cool to kind of see that process mirrored and every single place that's opening. And, go ahead.
I wanted to ask you, so if you're moving it on to other Walgreens, does that mean all the Walgreens are under the same block grant?
Under like the same person or like the same?
No, so what's paying for this is a block grant from.
Oh, yeah. Yes, then yes. It's under the same umbrella of what's being funded for it. Yeah.
And you guys got picked first because of your medical director. I'm just saying that you guys already had a medical director in place.
I believe it. I think that makes it a little easier. Yeah, for sure. Mm-hmm.
Yeah. So congratulations.
Thank you. It's been, like I said, it's been a very interesting process, and it's exciting that it keeps growing and more people are getting involved with it. And what's even cooler, so you saw the video, Starlin, that was out in the social media world for a little bit. You know, that video has been, you know, that was when we first got started. So that was really cool.
I saved it.
Yes, I have it too. I have it saved on my computer too for my own posterity. And then what's even cooler, before all the other sites and states opened up, we actually filmed a training video too, which yours truly is also in. So I'm going to be in that history forever, which is really cool. But again, the experience itself is invaluable, and I think it's really cool.
Okay, Hank, you're unmuted. Go right ahead.
I had a question about your authorization to prescribe the test. We were told in this town hall over the past couple of weeks that only pharmacists working in a lab that had a CLIA waiver were authorized to use that authority. Do the Walgreens stores have the CLIA waiver?
The CLIA waiver, yeah, from what I understand, they do to be able to perform the tests on site with the Abbott machines. I do believe, because at one point we were doing healthcare testing for other things, so I do believe that they do have the CLIA waiver in place.
Okay. Also, every Walgreens has a CLIA waiver because they teach glucose meters and also they have immunization.
Correct.
For the OSHA.
Any other questions or comments? All right. Well, we'll let you go. We put you a little bit under the gun for almost 20 minutes.
No worries.
So it was a great discussion. As I told you, everyone's really excited about this. And I know that, you know, we've had, I believe it was Lisa talking before. So, you know, I greatly appreciate, you know, we're fortunate to have leaders in multiple areas on this COVID infection and trying to battle it. And we're very pleased that we have such wonderful leaders out there taking the steps forward to help to get this under control. So thank you, everyone, because we have all had to step up in various roles in this pandemic. So thank you very much.
Way to lean in, Louis. Thank you.
No problem. Happy to do it. Thank you so much.
All right, and then let me switch over here to our normal updates. All right, everyone. Oops. Let's see here. As a reminder, you guys do very well now with muting your microphone and raising your hand in the chat. So again, just a reminder that we're going to try to help address any questions that you may have. And of course, from a global aspect, we're just under 5 million cases now, with 1.5 million cases in the United States alone. Unfortunately, we're not seeing a slowing completely throughout the country yet. As we're expanding testing and reopening states, we're going to see a mixture of both increases on that level. When looking at Illinois, as of right now, today, we went over the threshold of 100,000 cases and the threshold of 4,500 deaths. We are now at 100 of the 102 counties do have had at least one active COVID case. And that's despite a lot of people thinking that other areas outside of Chicagoland are not having infections. We definitely are still seeing that. All current of the 4 regions or the 5 regions are still at level 2. The governor did today redefine some of what's going to be allowed in phase 3, which will be rolling out at the end of this week and at the start of the next week. So there's going to be some modifications to what phase 3 is going to look like, with a little bit more openness on restaurants being able to have outside seating and some other determinations that came out today as well. When it comes to social distancing, we're still have a grade of F, but so does most of the country. And a lot of the states, as we've continued reopening, we're just not, at least showing with cell phone data, showing that we're staying, the respectful distance apart from each other. So it'll be very interesting to see, again, how this impacts cases going forward here in a couple of weeks. As you can see from this data, the southern counties and a lot of the central counties are now solid orange. A lot of the Chicagoland area, despite the number of cases, and they've been dealing with the biggest hit of this, are failing in their social distancing, at least according to the data. So we'll definitely see where we go. As we're talking about testing, CMS came out today. Well, it was officially dated yesterday, but it came out today with a clarification on what they were looking at with pharmacists being able to order and prescribe. And basically what they're clarifying with this document is stating that their declaration of that pharmacists have the authority to order and administer tests overrides any state or local pre-exemption that would prohibit pharmacists from being able to effectively administer this order. So this really helps clarify stuff. In Illinois, we already had that explanation with the order that came from the Department of Financial and Professional Regulation back on April 10th. But this does help clarify for other states, and this kind of help open up a clear way that we're able to process these prescriptions or process these orders through as laboratories. And you can still do incident to billing, but again, that's meaning you're going to have to be working with a physician. But at least for right now, as we've stated, that you're going to need, your pharmacy is going to need to have a CLIA laboratory license, and that's going to be the way your avenue to bill. And, oh, go ahead, Starlin. I know I said something wrong.
So if you're a DME biller, you're already classified and enrolled. You just need to addendum what you're doing with your enrollment prospectus. So it's just, you fill out that, you just identify what you've already filled out if you're a DME provider.
But you do need to still have to clear a laboratory waive license. So,
right.
And to make perfectly clear, because I've had to answer this a couple times this week, you can only perform waived tests. And right now there are only 3 waived COVID tests and 1 waived antigen test. So you have to stay within the realm of the waived test. So be very careful about that. We're working on a guidance document based on what some other organizations have put through, just to kind of help make it Illinois specific. I'm kind of hoping to have that drafted out for everyone, hopefully by this time tomorrow. The General Assembly did come back today. Lisa's asking, what is the billing cost for the COVID test? Starlin, have they released that number yet? No, they have not.
It's probably going to be between 50 and 110. LabCorp gets $110. FYI, in general. That's a Medicare cost that I'm sharing with you. I'm not colluding.
Right. You're using public data based on the ranges for Medicare. And so, great questions. So the General Assembly did come back today, just to let everybody know. It was a very interesting session. As you know, as we talked about last week, they're going to be in a special session for today, tomorrow, and Friday. And they may be back next week for a couple of days. It all just depends on what is happening. The budget process has kind of started. The shell bills that will become the budget did pass both chambers today, so that the budgeteers in the General Assembly can finalize what they're talking about, a supplemental budget for what's going to look like for June, and then a FY21 budget. And the draft that's been out there right now is a short 2,200 pages. So if you need any help falling asleep tonight, please feel free to download House Amendment 1 to House Bill 64. But we did take a quick look at it. All pharmacy line items at the moment are secured, including the critical access pharmacy fund. So we're glad to see that that's still being upheld in the upcoming fiscal year budget. We also, in addition, to kind of let everyone know how the General Assembly is operating, the House is not meeting in their chambers at the state capitol. They are using the Bank of Springfield Convention Center, or what you may have known as the Prairie Convention Center. And so all members are spaced out accordingly, and it was unusual watching them in a convention setup, but they each had their own microphones. Voting took a little bit longer because I think the computer system is not as reactive as the House system that they're normally using, but they were able to issue debate today. There was, of course, some issues with a couple representatives, at least one being removed because of failure to meet public health standards. And but it took very quickly for the representatives to kind of fall back into normal debate mode, for lack of better phrasing. There was the typical volleying back and forth very quickly, so it doesn't matter if they're at the convention center or in the House. Things did seem very much as back to business as normal. In the Senate, it was very different. The Senate did elect to remain in their chambers. But the senators were viewing from their respective offices. And as you remember from the Capitol, the senators' offices are all very closely within their wing, unlike the House, which most of them are in the Stratton building. So the senators would debate if they had a question on a bill that was based on the calendar structure, and the calendar is very restricted during the special session. They would come to the floor to ask their questions, and then they would leave. And they would vote in groups. And the Secretary of the Senate would call on groups at a time to come vote. So voting, unlike the House, which has set up a new electronic system, which we'll see what all the costs of setting the House up remotely will be later. But the House was able to still vote in a normal fashion, where the Senate, it did take a long time to get through bills. So it'll be interesting to see over the next couple of days if the Senate may amend some of the procedures as they've gone through this full day logistically to see if this is still the best way that they want to go through. So the General Assembly will be dealing with the budget, as we already said. Those bills are already starting to move. They didn't really address much else in this session besides some resolutions and normal business, but they're looking at whether the fair tax issue that we've talked about will be part of the budget. I mean, part of the election ballot this November. Hospital assessments. They're going to be dealing with any bills that have to be that are involved with anything that may expire between now and June 1st of next year. There's also some employment, COVID response related bills on employment labor emergency packages, looking at workers' comp and paid sick leave. Also looking at governmental administrative packages. There's some looking at trying to increase broadband for the court system, trying to increase relief for parks and museums, speedier trials. The Secretary of State looking at some additional things. And then healthcare wise, there's telehealth access is being looked at. And of course, a lot of these amendments have not materialized. And so they're looking at telehealth, behavioral health, which we know there's talking about this, allowing behavioral health systems to help with distributing mental health services, HFS, feasibility studies, kidney disease task force, and then of course another revenue package, and just general support for healthcare workers, frontline workers, and essential workers. And we're not sure what that looks like yet. That's a bill that we've heard rumored. But that's what we're looking at from the General Assembly side of things, at least right now. I don't see how they're going to get through all of this by Friday, so they're more than likely will be back again next week. One of the bigger things that happened earlier in the day at noon for the 10:30 JCAR meeting, and I said that correctly, that there was a proposed rule for the Illinois Department of Public Health, specifically looking at adding in additional violations or trying to explain or expound upon the established violation of any of the public health guidelines. And that would be a Class A misdemeanor. And I'm sure a lot of you have seen social media, especially some of you that were in the southern part of the state, would definitely be seeing those aspects. So at the last minute, after most of the day progressing through a lot of negotiation about this bill or about this proposed rule, emergency rule, the department decided not to present it to JCAR. And it's good or bad because the governor in his press conference today said that they will be looking at it through a legislative vehicle now. So it's going to come back for full debate. And it sounds like it may come back with even further descriptor language to it. One thing to remind everybody, and especially if you're talking with friends or you have friends that are business owners that may be looking at situations where they're going to violate current stay-at-home orders or this county stay-at-home orders, as a reminder, the proposed rule was looking at putting in additional expansions upon Section 8.1 of the Public Health Act. Section 8.1 of the Public Health Act states that it is a Class A misdemeanor. So the rule didn't establish a Class A misdemeanor. It was always there. And it also directs state's attorneys to prosecute businesses that are in violation of Department of Public Health orders. So this is going to be an interesting situation as we go forward, because the establishment for punishment and prosecution has already been established. Now, again, that doesn't greatly reflect a lot of our businesses because we're already essential businesses or we're in compliance and operation, but it may impact businesses that you may be related to depending on your structure of your ownership or you rent from. So you may need to have those discussions because you don't want those liabilities coming back, because the state has already sent letters of cease and desist to bars in particular and restaurants through the Liquor Commission. And so you may see similar things happening through DFPR if you just want to make sure that your businesses aren't having any other issue. So that's all I had for quick updates for you for this week. Does anyone have any questions or comments? Any info about access to COVID tests and test training would be greatly appreciated. The test training is still being developed. Actually, there's going to be some conversations internally with us and other organizations later on this week about the training. Access to COVID tests are, we're working through, we know 2 of the 3 major wholesalers have access to tests. And again, at least for the time being, I highly recommend using your contacts through your wholesalers to be able to obtain tests. Again, there are a lot of companies that are purporting to have access to tests, and they will state that they're FDA registered. And we worked hard with a member yesterday who was getting information from a company where they were saying that these were FDA registered and that they could be used by any medical personnel. And after we finally dug through a lot of the information on the FDA website, we found out that yes, this company's test was FDA registered, but it's not FDA authorized. And so they're able to distribute them under the emergency use authorization, but until the FDA clears the test or fully has a full authorization, they're only limited to high complexity testing laboratories, which you are not. You're only a wave laboratory. So you do need to make sure that you're doing your due diligence. Again, we're going to be having a guidance document that'll have those 4 tests on it. IPHA has put together a very good FAQ that we'll be linking to as well. Starlin worked really hard with IPHA staff on getting this COVID testing question and answers out for everybody. And we want to make sure, again, that we do this appropriately because, again, as we've stated many times, this is new territory for us. We want to make sure we do this correctly going out because we want to keep this going forward because we're not going to give up this authority that's been given to us, and we don't want to mess it up. And we want to make sure that we're doing it appropriately. We want to make sure all our peers, and this is where we're going to have to help check each other as we go through this process. So I want to make sure that we're doing this a little bit of a slower roll than we normally would. So, and I appreciate everyone's patience as we progress down this new path. Any questions or comments? You guys have a couple more minutes. I know some of you may have dropped off because I know there's a PBM Supreme Court CE that's going on right now, and I understand why some of you may be needing to drop off. Are there any questions at all? Starlin, you're unmuted. Go ahead.
I wanted to ask if there's anybody currently on this call that is an accredited diabetes education pharmacy that offers DSMT to Medicare. If you are or you know of any. I went through the map and couldn't find anybody in Illinois other than Dominic's and Kmart, and neither one of them are doing it anymore. We have found we have an ear in CMS's office, so they're wanting to talk. They want to know a real pharmacy that is wanting to bill for diabetes education, that has already gone through the accreditation program, and why we need telehealth privileges. So there's several in Texas, but I wanted to reach out to know if any of you knew of anybody in Illinois that's providing diabetes education in group settings to Medicare beneficiaries. You know, Starlin at IPHA.org, so that we can show examples. I mean, so we're partnering with the American Diabetes Educator Group, and we have the map, but they want to reach out, and they need a real story to tell. And our program is with commercial self-insured employers, but we're using telehealth because we have permission from them. But if we can get Medicare to do it, because the last group of people that need to be walking into a clinic right now are people with diabetes or cardiovascular or asthma or COPD. So if you know of those examples, email me, because we have their ear right now. So we have a very small window to get that open. The second thing is, when we start this process of training, please identify your team that includes a hotshot pharmacy technician that can help you do all the paperwork when we start doing all these billing processes. I think this is a joint effort, and while the pharmacist is going to be the clinical arm, we're going to need super techs to make sure all the billing and all the paperwork and all the flow. So anybody that's done DME, and I've done that before, and I had a home infusion, I'm just saying that I wouldn't have had a good practice had I not had two really super techs that watched every I and every T crossed. Am I right, Louis? So the paperwork that's involved in this will be cheaper when we use our pharmacist extenders as equally training. So when we start doing I want you to start thinking about this now, so that if we launch things, that we're launching this in a collaborative process with our pharmacy technicians, our student pharmacists, and our residents.
Okay. Thank you, Starlin. Any other questions or comments? All right, everyone. Well, thank you again very much for attending, and we'll see you all next week. And think about next week. We'll ask a question again, whether we keep being diligent and keep working with these on a weekly basis, or if we move to a bi-weekly basis, or just let us think about that over the next couple days, and we'll talk about it again next week. Thank you, everyone. Have a good night.
Thank you, Louis. Congratulations on your personal success.
Oh, thank you. Appreciate it, guys. Couldn't do it without you guys. So thank you so much. Bye-bye.
Bye.